Good morning. I am Dr. Ugbooma Daniel, a renowned general practitioner from Nigeria. I studied in the University of Nigeria in Nsukka, completed my studies in the year 2017, and I studied the course Medicine and Surgery, as we call it in Nigeria, bagged the prestigious Bachelor of Medicine and Bachelor of Surgery degree from Nigeria. I have the following qualities. I am accountable, I am bold, I am calm and calculated. I am dedicated. I am efficient. And I'm an effective team worker. Also, I'm a team player. I consider myself a team player. I can also play the role of a team leader. I proceeded after my studies to the prestigious Lagos University, to a tertiary institution in Nigeria of first level, where I was enrolled in a residency program into the Department of Surgery. And over there, I collect patients, take their history, I examine patients' full systemic examination, general and systemic examination. I request for investigations after giving a provisional diagnosis and differential diagnosis. Then I review with my senior colleagues, senior registrars, consultants, professors in the units for onward treatment and management of this patient. I prepare the unit morbidity and mortality statistics. Then I am also responsible for giving weekly clinical talks or clinical presentation to enhance my medical knowledge. I am also involved in coordination of the house officers for ward rounds, clinics, and surgery days. I'm also in charge of coordinating record keeping of the cases operated on weekly basis. I am also, in fact, the eye of the unit, as I may call it. I also had experience, part-time experiences in some private hospitals, namely when I finished my internship, which I did at the Federal Medical Center, also a tertiary institution, however, located in Niger State. Over there, I performed duties such as sample taking, urethral catheterization, chest tube insertion. I also am also responsible for taking history, physical examination at my level, then reviewing patients with my registrar at the time. I also make presentations to enhance my medical knowledge as at that time. I now proceeded to the level of a medical officer, which I did in primary healthcare center, where I was alone. I was the only medical officer attending to emergencies. I was responsible for stabilizing cases when they present, then refer them to secondary or tertiary institutions. So my work was actually a tedious one. However, during my stay in that community, I achieved a lot. I actually reduced maternal mortality in that community and increased the health status of the people in the community. To the extent that during my leave in the community, I was offered opportunities to continue working with the community which, however, I declined, explaining that I've gotten a higher offer by the federal government of Nigeria. During my stay in Lagos, I worked in a couple of private hospitals, to mention but a few: Medwin Hospital Limited and the others, where I garnered experience as a general practitioner. Hence, as a general practitioner, I have 5+ years of concrete experience. Hence, I'm not alien to any medical case. In this year, around March, I proceeded to write my Ministry of Public Health exams, which I aced with a pass on March 18. Then I proceeded with my data flow verification, which I have completed, and I also have enrolled in some courses and certifications, including basic life support, first aid and cardiopulmonary resuscitation course, even advanced cardiac life support course, and the pediatric advanced life support course, all which I aced. I am open to be employed by anyone who needs a committed, dedicated, calm, and a team player general practitioner. I am married with 2 kids and a lovely wife. I have a lovely home. However, I'm ready to relocate anytime once hired by a reputable organization. Thank you. You can find my contact details at the end of